Let's see the process of seeing. As you all know, eye works like a camera. So when the light passes through the cornea, pupil, lens and fluid of the eye, which will be focusing the light onto the retina, which is very important to the retina. Then the image is projected upside down on the retina. The image will be projected upside down on the retina, and the retina converts this light into nerve impulses, which will be sent to the brain. Then the brain interprets these impulses, which will turn the image right side up and develop a picture of the object. As you can see in the picture, the brain interprets exactly, to be precise, which part of the brain? Occipital lobe. So you know, occipital lobe is responsible for vision. That's what the whole process of seeing about. Now we will see the refractive error, myopia. If you can see in the picture, the light is focusing in front of the retina. So the light is focusing in front of the retina, the myopia happens. So what is the kind of vision you have in myopia? You can see in the picture, myopia, if you have, okay, so you have to see that the near object will be very clear for the patient or the person, okay. So the nearby objects will be clear, but the far away objects are blurry. So this is what you have to remember about myopia. The nearby objects will be clear and far away objects are blurry. The myopia correction is done by the concave lens. So the corrective lens using for myopia is concaving lens, which is otherwise known as diverging lens. Okay. So what happens if you use concave lens for myopia? The lenses will spread the light rays slightly, so they will be focusing correctly on the retina. So that's how the corrective lens that we use for myopia. Now, the interesting part, how do you remember myopia? Myopia, when you say my, you put your hands on your chest. My is something near, is it not? So it is nearsightedness. Myopia, you can otherwise say it is nearsightedness. It is nothing but you can see the near thing. Okay, so that's what we explained. The near things are very clear, but the far away objects are blurry. So myopia, it is nearsightedness. Next in the refractive errors is the hyperopia. If you see in the picture what happens, the hyperopia which is caused by the light when it focuses behind the retina. You can see in the picture clearly behind the retina, if the light focuses, hyperopia happens. And why? There may be many reasons. Few reasons are when the eye is shorter than the normal or the cornea has too little curvature, this can happen. Now, what about the vision? Okay, with the hyperopia, you can see in the picture, patient typically experience difficulty in focusing nearby object, which means the nearby object will be blurry. But distant vision will be usually clear. That is, far away object will be clear. Okay, so this is what happens in hyperopia. The hyperopia correction is the corrective lens that we use for hyperopia is convex lens, which is otherwise known as converging lens. So when you use the convex lens, okay, this will bend the light rays inward. So the focus will be directly on the retina. So the corrective lens for hyperopia is convex lens. Now, how do you remember hyperopia? Hyperopia, hi. When do you say hi to someone? You can see somebody coming from far itself, you can say hi. So from the far itself, so far-sightedness, you can see the far away thing. So that's what the hyperopia is all about. Hyperopia, far-sightedness, you can see from far, but the nearby object will be blurry. Astigmatism. Astigmatism happens when the light rays focus on multiple focal point, as you can see in the picture, rather than focusing on the retina. When it has multiple focal point, astigmatism happens. It may be due to the cornea or lens. When it has irregular shape, the astigmatism happens. Now, what is the kind of vision people have with astigmatism? The astigmatism can result in blurred vision or distorted vision at any distance. It is not far or it is not near. It can result blurred or distorted vision at all distance. The corrective lens, what we use for astigmatism is cylindrical lens. So these lenses are designed to correct the uneven curvature. So that's what we use it for, cylindrical lens for correcting astigmatism. So the video was all about, we started with normal vision, that is the focal point is directly on the retina, we will have normal vision. Then we discussed about myopia or nearsightedness when the focal point is in front of the retina. Then we moved to hyperopia or farsightedness when you have that focal point behind the retina, and we discussed about astigmatism too when you have multiple focal point. If you like the video or if you find the video is useful, please don't forget to subscribe the channel and like the video, and you can share the video to your nursing friends as well. And while subscribing, you can just press the bell icon so you will get notified every videos as I post. Thank you so much for watching.